Ketoprofen is a non-steroidal anti-inflammatory drug NSAID that is used to relieve pain and reduce inflammation. Its pharmacology involves inhibiting enzymes called cyclooxygenases COX1 and COX2, which are involved in the production of prostaglandins. By blocking these enzymes, ketoprofen reduces pain, inflammation, and fever. It is commonly used to treat conditions such as arthritis, menstrual cramps, and minor injuries. Like all NSAIDs, it can have side effects and should be used under the guidance of a healthcare professional. Ketoprofen, like other non-steroidal anti-inflammatory drugs NSAIDs, can have common side effects. These side effects can include 1. Gastrointestinal issues, stomach upset, indigestion, heartburn, and, in some cases, more serious issues like ulcers or gastrointestinal bleeding. 2. Headache. Some individuals may experience headaches as a side effect. 3. Dizziness. Ketoprofen can sometimes cause dizziness or lightheadedness. 4. Skin reactions. Skin rashes or itching can occur in some cases. 5. Fluid retention. Ketoprofen may lead to fluid retention, causing swelling in the legs, ankles, or feet. 6. Elevated blood pressure. It can sometimes lead to an increase in blood pressure. 7. Kidney effects. Ketoprofen can affect kidney function, potentially leading to kidney problems in some individuals. 8. Allergic reactions. Rarely. Ketoprofen can trigger severe allergic reactions, such as hives, difficulty breathing, or swelling of the face, lips, tongue, or throat. The appropriate dosage of ketoprofen can vary depending on the specific condition being treated, the patient's age, weight, and other individual factors. Typically, the dosing guidelines for ketoprofen are as follows. 1. For pain and inflammation. The usual starting dose for adults is 50 to 75 milligrams taken orally every 6 to 8 hours as needed. For children, the dose is based on their weight, typically ranging from 0.5 milligrams to 1 milligram per pound of body weight, divided into multiple doses. 2. For osteoarthritis or rheumatoid arthritis. The typical dose for adults is 75 to 150 milligrams per day, divided into 2 or 3 doses. Ketoprofen can interact with various medications and substances, potentially affecting its effectiveness or increasing the risk of side effects. Here are some notable interactions to be aware of. 1. Other NSAIDs, concurrent use of multiple NSAIDs, e.g. ibuprofen, aspirin. Naproxen can increase the risk of gastrointestinal side effects and may not provide additional benefit. 2. Blood thinners, anticoagulants. Ketoprofen can increase the risk of bleeding when taken with anticoagulant medications like warfarin. 3. Corticosteroids. Combining ketoprofen with corticosteroids, e.g. prednisone, can increase the risk of gastrointestinal bleeding and ulcers. 4. Antiplatelet drugs. Taking ketoprofen with antiplatelet drugs like clopidogrel may raise the risk of bleeding. 5. Certain antihypertensive medications. Ketoprofen may reduce the effectiveness of some antihypertensive drugs. 6. Diuretics. Ketoprofen can reduce the effectiveness of diuretics water pills and potentially lead to increased blood pressure. 7. Lithium ketoprofen and may increase lithium levels in the blood, potentially leading to lithium toxicity. 8. Methotrexate. Concurrent use of ketoprofen and methotrexate can increase the risk of methotrexate toxicity. 9. Selective serotonin reuptake inhibitors 3. Combining ketoprofen with SSRIs like fluoxetine may increase the risk of gastrointestinal bleeding. 10. Alcohol. Alcohol can increase the risk of gastrointestinal side effects when taken with ketoprofen, so it's best to avoid or limit alcohol consumption.